Hello, my name is Trinity, and I guess welcome to my quarantine. So, I've come down ill. There really aren't enough tests to go around to test right now people that are not in a critical condition. So, I'm just home in isolation right now. I've been working for the last 8 weeks or so with people on COVID-19 and writing articles, doing raising awareness, researching, mining data, things like that. And especially with me being sick and feeling a little bit not so great, I decided to sit down and take some of the information that I've learned and some of the stuff that I've put into my written articles and create some videos to help spread information in another way. So in this video, I'm going to be talking about risk factors for COVID-19 and things that we can do to stack the odds in our favor and lower our own personal risks. So the big one that everyone talks about, of course, is age, which of course we can't do anything about our age, but what we can do is make sure that if we are over the age of 65, that we are in good communication with our doctor, taking any medications that we need to be taking regularly to maintain our health. If you've got any conditions that are out of control or not properly controlled right now, it's very important to speak with your doctor and to do what you need to do to try and get those conditions under control and just get your health into as good a state as possible. And the thing that everyone around an older person can do is to ask them if they need anything to limit their exposure in public, grocery shopping, going to the post office, anything like that, to kind of help them not to become infected in the first place. The next big risk factor is another obvious one, and that's smoking. COVID-19 affects the lungs. It gives pneumonia, and many of the people that get into critical condition or die from this, it's because of respiratory failure. And we've seen in the data that smoking is definitely a big risk factor. If you smoke, your odds of complications leading even to death are much higher than someone else. So you got to quit smoking. The next one can be a little less obvious, and it is obesity. Aside from, in and of itself, it can cause many of the risk factors that we attribute to COVID-19. And I will link all of the science sources for all of the information from this video in the description below, as well as the original article that I wrote on all of this, so that you can take a look if you'd like to. High blood pressure greatly increases your risk. Diabetes greatly increases your risk. Any kind of heart conditions greatly increase your risk. Breathing problems, which can sometimes be even associated with obesity, greatly increase your risk. So what you want to do, because this is not a situation that's going to be over in a week or a month, we're hoping to be able to get this at least under control in the next 3 months. But the virus is not just going to go away. The ability to be infected with this is going to be with us for quite some time. So it's very important that we all improve our health and improve our odds as much as we can, as soon as we can, so that if at a later time we do come in contact with the virus, that our odds are much better that we will have a milder case and be able to recover from it completely. So the three main factors that I looked into when it comes to weight loss, as well as just improving everyone's overall health, are giving up added sugar completely out of the diet, drinking at least 2 liters of water a day, and beginning a 5-day-a-week exercise program. Now, even if you don't make any other dietary changes, if you just give up any kind of sugar, added sugars into your diet, you will, and don't do anything else different. Don't add those calories back in with something else. You will begin to see a slow and steady weight loss from that. And quitting sugar, even if you are in relatively good shape, if you are continuing to consume sugar, studies are pretty clear that negatively impacts your health. So you're going to want to give that up. Drinking a lot of water allows our bodies to detox themselves properly, It takes strain off of your kidneys and a lot of other systems in the body, which COVID-19, in some cases, we have seen that it has caused damage to other organ systems in the body other than just the lungs. That's not the typical case, but it does happen, and we have seen it happen. And then, of course, exercise. Yes, it's important for weight loss, but more importantly, it strengthens your heart and it strengthens your lungs. And those are the two systems that COVID-19 seems to affect the most commonly and the most severely as well. Even just 30 days of an improved diet and exercise program, it reduces your risk factor and it ups your odds that you will have a full recovery from the virus. That's not, obviously, there are no guarantees with this. Even somebody in the best of health could still potentially get into trouble, but it's a numbers game. It's about stacking our odds in our favor. Avoiding infection as best we can to stack the odds for ourselves, and then being in as healthy of a condition as we can be, so that if we do come in contact with the virus, like I said, we have a higher chance of a full recovery. So this is something everybody should be looking into very seriously and doing this right now. Now, excuse me, I've got a very adorable kitty cat sitting on my notes. Excuse me, leopard man. Excuse me, leopard man. So some of the other chronic conditions that can get even a young person into trouble with this are asthma, COPD, any kind of issue with the lung. Again, whether it's diabetes or a heart condition, what you really want to do is contact your doctors, work with them, and make sure that your conditions are managed as well as possible, especially if you know right now that you've got your asthma's out of control, for example, or your diabetes, your sugar's not being well controlled. You really want to take the time and speak with your doctor and come up with a plan moving forward to gain better control of those conditions. And again, it's a numbers stacking game to increase your odds and to increase your overall health. Now, one of the things that science has come to understand is that sleep has a major part to play in our immune systems. And one of the key factors in relatively younger or healthier people, or anyone in general really, not sleeping well, is having bad sleep hygiene. And what that means is waking up and going to bed at the same time every day, and what you do in those 30 minutes before you go to sleep. So what's recommended is that for 30 minutes before you go to sleep, you're not looking at any digital screens of any kind. Again, I'll link the study down below, but they affect the brain waves in certain ways that do not set your body up to be in a state where it can go into a restful, deep sleep very easily. So you want all the screens off at least 30 minutes before bed, and you want to develop a routine. And that routine can be as simple as going in, washing your face, brushing your teeth, and meditating for a few minutes, or reading from a paper, preferably book, for a few minutes before you go to sleep. Just something that can kind of cue your body up over time, that your body will learn, oh, these are the things that mean it's time to sleep now. And that's what it means to have good sleep hygiene. And it is very, very, very important in order to increase your odds yet again. And that's something that we all need to start doing. All of us need to do it, myself included. Do as I say, not as I do. No, we all need to have better sleep hygiene. It's something that I think a lot of us have kind of let go of over time. Now, we've been covering some of the things we know for a fact, risk factors with this. Now, this last one I'm going to add in, I'm going to say that this is just a theory at this point. I have found a couple of studies, a couple of papers that they're not yet peer-reviewed or anything like that, but they were coming out of both India and China, discussing what they call the viral load theory, which is that I find it really interesting, and I don't have a background in these things, but so I don't know whether this is even a possibility or not, but I thought it was worth mentioning just for somebody to look into. the concept that the amount of the virus that you're exposed to at the time that you're infected may play some part in the outcome. So for example, if you're exposed to a large amount of the virus at once, so let's say you've got a person who's very ill and you are right up close to them and they're directly coughing into your face, right? As opposed to someone that just has a small contact with the virus that causes infection. So say like touching something and then touching their face and only a little bit got in, that actually may play a part in the outcome. The reason I believe that this theory kind of came up has been trying to explain why so many more doctors and nurses and medical personnel are having fatal outcomes than other individuals. And while I'm sure that sleep loss and being exhausted play into it, there have been some who have theorized that that has to do with the amount of virus you come in contact with. Now, whether that turns out to be true or not, it is important that we all do everything that we can to limit, minimize, have zero, if possible, contact with the virus as possible anyway. It's something we should be doing anyway, which means washing our hands, which means social distancing, which means disinfecting commonly touched objects like cell phones, doorknobs, keyboards, things like that with, Lysol, alcohol-based sanitizers, things along those lines. So even though, I'm not sure that I completely, I'm not sure that I believe the viral load theory. Reducing our exposure to the virus as much as we can is something that we should all be doing anyway. So I just wanted to put that in. All right. So if you guys have any questions, I'm more than happy to answer. If you would like to continue to see more videos and more information about my research and my journey through all of this with COVID-19, including my both personal and then the one, with me researching it and writing articles and writing news stories on it. Please subscribe, hit the bell icon so that you can get notified when my next videos go up. All of the work that I do is completely unpaid. Before I got sick, I was working 12 to 16 hours a day, 7 days a week, for the last 8 weeks solid. And even sick, I'm still working, probably a lot more hours a day than I should be on this. So if you would like to help support what I do and help support being able to upgrade the website, get advertising, get the word out to as many people as we can, I'm going to put a link to my Patreon down below. And I guess that's it, everybody. Stay safe, and I'll see you later. Bye-bye.